weekly member update today. We are going to try to, if possible, end this call a little early. We know there are a lot of inauguration activities going on today, so we apologize for the call being at the same time as those events. With that said, I'd like to hand it over to Melissa to kick us off.
Good morning, LeadingAge Virginia members. Thank you for taking the time to be with us this morning. Dana asked me to share some words of wisdom. These are not mine. These are Maya Angelou's, but they seem prophetic today. We cannot change the past, but we can change our attitude toward it. Uproot guilt and plant forgiveness. Tear out arrogance and seed humility. Exchange love for hate, thereby making the present comfortable and the future promising. So as we look at the transition that is happening right now for our country, I hope that we can all anticipate this transition with some hope and humility. So thank you again for all that you do for those you serve, and thank you for being a part of LeadingAge Virginia. Dana, back to you.
Thank you, Melissa. I'd like to begin with Juliana Gordon, who's going to provide us with a brief update on the PPE exchange. Over to you, Juliana. You may need to star 6 to unmute. Okay, well, seems while we're getting Juliana on, we will begin with our Department of Health update. So, Mike, if you could give us a little bit of an update on what's happening with the Pharmacy Partnership Program.
Great. Can you hear me now?
Yes.
Okay, good. So you guys should be showing the slide that shows the updates in terms of skilled nursing facilities and assisted living facilities and the status of their completion. This data actually comes from the CVS and Walgreens own websites, and there's a little bit of a data update today. So as of yesterday, CVS had reported that they had completed all 195 of the skilled nursing facilities for their first vaccination event that were assigned to them. And so they're now actually this week beginning their second visits at some of those facilities. And then also CVS has begun vaccinating in the assisted living facilities and quote, others that are in there that are either assisted living or skilled nursing. And the most recent data shows that they've now done 208 of the assisted living facilities, and that's on their website. They've got scheduled visits in the next 7 days. They've got 177 visits in the next 7 days. So that's their workload. Walgreens is showing that now 78 of their 87 skilled nursing facilities have completed their first visits. I understand that there are some first visits for those facilities that are still scheduled this week and into next week. And then for their assisted living facilities, they're now reporting 108 of those have completed their first visits. They've got 25 skilled nursing facilities scheduled in the next 7 days, so that's first and second visits, and 68 first visits at assisted living facilities over the next 7 days. The total doses showing on the slide, 43,596. That's a little bit outdated. Now we've got a combined total of 52,246. So that's where they're at. There were, again, those 171 facilities that Walgreens accepted that are assisted living and others that were accepted on December 29th. There was a delay in getting services to those facilities. I understand that they thought they had reached out to all of them through the introductory email, but we found out earlier this week that wasn't the case, that some of those facilities still hadn't been contacted. So Monica and I are pointing those out to our Walgreens points of contact, and they should be reaching out to them by today if they haven't. So that's pretty much it in a nutshell. I mean, overall, the process is moving along. not showing on the slide, we've got lots of group homes and some other types of facilities that are not covered by the CVS and Walgreens program. We are working with Family Care Pharmacy to vaccinate in the behavioral health group homes. There's about 4,300 in Virginia. Only 438 have signed up for this program. So that's something that they're working through. And other facilities, that if they're not included in this program, should be working with their local health district or through other private pharmacy providers that are signed up as vaccine administrators. That's all I have, pending any questions.
Mike, thank you so much. For adult day settings, what would be your recommendation for those centers for the vaccine?
Yeah, so for you talking about adult daycare, so they would not
Yes,
be included in the long-term care project.
right. But as far as, yeah. Mhm.
Yeah, I would recommend that they reach out to their local health district. There may be other pharmacies that are coming online that will have vaccine that normally help provide services to these groups, but you know, there's not a one size solution fits all from the state at this point.
And regarding I'm sorry, I see a question has come in. Melissa?
It says, what was the method used by CVS or Walgreens on which SNFs and ALFs got scheduled early in the process rather than later? So it sounds like they're asking about the prioritization of scheduling the nursing homes and the assisted living.
Correct. So there are what we call two parts of this program, Part A and Part B. Part A was activated on December 28th, and that included just the skilled nursing facilities. And then Virginia activated Part B, which included assisted living facilities and others, and that they could start their vaccinations for that on January 11th. So a little over a week ago, they were able to start vaccinating the assisted living, and that's why, you know, they are after the skilled nursing facilities. And that was, you know, based on how the program was set up and based on how much vaccine we could allocate versus what was needed to get the programs rolling.
Yeah, I think they're asking for further clarification. So were the pharmacies going alphabetically through the list they got? You know, kind of how did they prioritize which SNFs were getting it in during that first go round? How did they prioritize their outreach for scheduling?
So I think both CVS and Walgreens used a different method from each other. They also, you know, they spread the workload out among multiple CVS and Walgreens stores throughout the state. Not every store is participating in it, but they included, you know, lots of stores around the state to geographically meet the needs. And so within those, you know, geographic distributions, the individual stores began to contact the facilities and begin scheduling them. You know, scheduling is pretty complicated, right? So there's a lot of back and forth, trying to pick a day that works for both parties. And Walgreens, you know, I know that they weren't considering their events scheduled until all the paperwork was signed and brought back. Whereas CVS, once they identified a mutually agreed upon date, they were counting them as scheduled and then working the paperwork. So a little bit different in the terms of the two different companies and how they scheduled. But, you know, I don't know that there was any specific method other than, you know, trying to just contact them, and whoever called back first got scheduled first, I think was probably their methodology, but I couldn't speak to that specifically.
Okay, one follow-up question is, so we're hearing that some local pharmacies are getting vaccines and they're partnering, you know, with the Department of Health to get vaccinations to independent living residents on continuing care retirement community campuses. But then we're hearing some say they don't have the vaccines. So could you just address, there seems to be an inconsistency around the state with regards to who has vaccines and who doesn't, that can begin administering those vaccines to these other populations.
Yeah, so the allocation of vaccines in the state right now, we're challenged because there's more individual locations requesting vaccine in higher amounts. then we can actually, ship out. So we had a lot of requests for vaccine this past week that were either canceled or just shortchanged. So that's true across the state. I'm not part of the prioritization committee as far as where the vaccines go, but I know, especially the Moderna vaccine, there's way more demand for the Moderna vaccine than we can actually allocate, and it's still true for the Pfizer vaccine. Almost really to the same extent. So even though there's more doses of the Pfizer vaccine available, it can only ship in increments of 975. So the amount of places that can receive it each week is decreased because of that factor as well.
Okay, that's all the questions I have, Dana. Back to you.
Thanks, Melissa. And just to clarify, for any community that wants to administer the vaccine following the pharmacy program, they would need to complete the provider intent form. I've put that in the chat box. Mike, I wanted to ask you a question about a situation that we had with a community dealing with their CVS representative for the pharmacy program, not staying in contact with them, not providing responses to their questions or responses to a request to have a logistics call regarding their clinic. In a case like that, when the representative is not communicating with the community, is there someone that you can recommend that community can reach out to with CVS to be assigned a different representative?
Hey, that's a good question. That's the first I'm really hearing of that kind of specific issue, and I think most of the responses that we're getting are pretty positive about the CVS and Walgreens relationship with the pharmacies. Once they get contacted and begin the scheduling process, I think most of the complaints I'm getting is the not getting the initial contact. But if you have a case like that, myself and Monica, and we'll follow up with the CVS point of contact and let them know and try and get some resolution to that.
Okay, thank you. I will follow up and connect you with that community following the call. So we have a comment, once the provider intent form is completed, when can we expect vaccines to be provided to them? Once the third clinic is complete, we need to have a pharmacy to provide to new hires and new residents.
Yeah, so that's a good question. So once the provider intent form is completed, that means that they're eligible to request vaccine. Right now, private providers are not able to request vaccine or order vaccine directly. They're working through their local health district. And local health districts get to pick up to 15 private sites each week to order vaccine for. And even when they do that, they're not necessarily all getting, honored because of the shortage of vaccines. So I can't really tell you the time frame between when you get registered and when you can start getting vaccine. Sooner is better, though, because the third clinics will be completed for the skilled nursing facilities by the end of February, and for assisted living by March. That seems like a long way off, but it's really not, considering how long the intent form process takes. So I would recommend that they start completing that now.
Thanks, Mike. Well, really, thank you so much for that update. We hope you can stay on for the entire call if any other questions come up. But I wanted to see if Juliana was connected with us to provide an update on the PPE exchange. Okay, well, we're going to move on to the Department of Health, Carol Jamerson, to talk with us a little bit about the guidance document that we really like to frame at LeadingAge Virginia as a conversational framework among the hospital discharge planner, long-term care admissions coordinator, and local Department of Health. So Carol, over to you if you'd like to talk a little bit about this. We have a slide up that talks about the criteria that has to be met in order to move forward with this discussion.
Hi, Dana. Can you hear me okay?
Yes, we can hear you. And I'm going to put a
Great.
link to the guidance document in the chat box.
Okay, great. Thank you. And good morning, everyone. I just wanted to let you know that there's been ongoing collaborative discussion between hospitals and long-term care and the long-term care task force to collaborate on a guidance document that addresses closing a healthcare facility to new admissions or readmissions during the pandemic. And as Dana said, the suggestion was made to add this language to the document, which it has been added, and it is noted that this is a conversational framework. It's meant for the local health department, the long-term care admissions coordinator, and the hospital discharge planners. And this particular guidance supersedes all previous guidance documents that have been posted. So the essential criteria for this document was really developed in response to the winter surge, the surging of patients in hospitals, and then how that reflects on long-term care, accepting admissions or readmissions and closing to admissions, and also just the conversations that the local health departments have been having throughout the state with their different facilities. So the idea is that we want to keep that patient or resident moving through the continuum of care. We don't want them stuck in any one level. And obviously, we don't want hospitals to not have beds. We don't want nursing homes to not have beds. We want to be able to accommodate the needs for patients and residents as their condition improves and they could go back to a nursing home, for instance, out of the hospital. So the decision was made that we really have to have this conversation together. We have to think critically. We have to look at what's going on in the community, the hospital, and the facility. And the criteria that's going to be included in making that decision is really looking at the number of cases that's going on in a facility with an outbreak. And that obviously would include staff and residents, and make sure that those case numbers are decreasing. We need to make sure there's not widespread transmission of COVID within a facility that's sort of gotten out of control, so to speak. And we need to make sure that a facility is compliant with all the best practices for infection prevention and control. And when you open this document now, you'll see that we've put a hyperlink in for those best practices. So you can use this tool to kind of go a one-stop go-to link and find out the most recent and the most updated infection prevention and guidance practices. You also need to make sure there's enough space, enough physical space for cohorting the positive versus negative, and that plan is in place and that it's a workable plan so that we can have a separation of care, and that there is an observational unit for those new admissions that we don't really know what their status is at the time. So they're in that waiting period. We have to make sure there's adequate staffing, there's adequate PPE and other supplies, and that the facility has a plan to manage new admissions and readmissions. So I don't think any of this is something that hasn't been happening. I think what hasn't been happening is we haven't had it all written in one place so that we could all see the same guidance at one time. So this document is meant to really look at these elements to say that while a temporary or a limited closure may be needed to get the outbreak under control, closing to new admissions for a prescribed amount of time is no longer going to be anything that's in writing. In other words, there has to be flexibility, and we're asking that long-term care really close for a limited number of days just to ensure that these elements are met and that the acute outbreak is under control and that the resources are there to provide safe care. I don't think any of us would argue with any of that. So now the framework of this document is there will be conversation, and there will be conversation between all the players to make the best decision. It also notes that CMS has never instructed nursing homes to close to new admissions. However, they have relaxed some policies to better allow for the transfer of patients, and there's a link for their CMS website as well as the COVID emergency declaration blanket waivers for healthcare providers. The good news is this is all on one page. Again, it provides the links that support the guidance that goes with this. It is on our long-term care task force page, and I think Dana put the link in she put the link in the chat. Thank you. When you go to our long-term care task force page, you will find this listed under guidance for all long-term care facilities. And it is noted in red that it's a new document and was updated and posted as of 1/19. And if you have questions, please feel free to put those in the chat. I'll be happy to address them any way I can.
Thank you so much, Carol. We really appreciate you taking the time to be on and also embracing this idea that this be a conversational framework. We really do appreciate that. So checking in to see if Juliana is able to
She's
join us.
on, but she's on, Dana, but she needs help being unmuted.
Okay.
I sent Paula the phone number that she's calling in from, so hoping that Paula can work her magic.
Okay, great. Okay, well, we'll just put that issue on hold for a minute and welcome Paul Timpain from Culpeper Garden to talk with us a little bit about the community's experience with their vaccine clinic. Over to you, Paul. Thanks for joining us. Okay, you may need to unmute.
Good morning.
Hi, thanks so much for
All
joining
right.
us.
Excellent. You're welcome. You're welcome. I was asked to join. We recently had our first of 3 vaccination clinics here at Culpeper Garden. We are a 273-unit low-income senior housing community managed by Coordinated Services Management, and we are a low-income community, but we are independent living, and so I can tell you how that works in the field. It is, as I would back up, the start has been a challenging start, but once it worked, I can tell you our experience was excellent. We had an excellent sales representative from CVS Omnicare, followed by a very professional actual vaccination team from CVS. So out of our 273 independent living units, we had 189 residents and 36 staff vaccinated for a total of 225 vaccinations. We used the Pfizer vaccine, so that's what we were assigned. There was no choice, so you are assigned what you have. And then we were assigned 3 clinic dates. One of the warnings I have for anybody on the call is that we received 5 days notice of our first clinic date. So my advice is for everybody to prepare as if you already have a clinic date assigned, because you may or may not get the 14 days notice that has been advertised. And so in our case, we had to pull it together fairly quickly. I think one of the ways I would advise everybody to do that is that you really need to bring your entire team into the effort, and that for the first of the 3 clinics, you need to focus on the yeses. You will have many folks in your community, both staff and residents, who have questions, concerns, need to consult with their doctors, et cetera, in order to become comfortable with the even first vaccine shot, but you'll have very many who are interested in immediate vaccination. So what we did is we focused on the yeses, making sure that they got signed up, giving constant updates, communication, and education to everybody who was interested. Assign your staff, control the forms, assign time slots. Organize your clinic by floor or by group, however your building is. We are a 9-story building, so we chose to organize our time slots by floor. And then day of the clinic, it's very important for the staff to be visible. The pharmacist group is visible. They're all in PPE and gowns and white smocks and identified. We wore our emergency yellow fire drill vests so that all staff were immediately identifiable. We had at least half my staff was assigned only to traffic control day of the clinic, because the folks will come down an hour before. Anybody who knows independent living or working with seniors, they will be there early, and they are. And so you need traffic control to separate your time slots. And then you need to enforce those by creating separate lines, separate gathering areas, all the while maintaining social distancing. So there takes quite a logistical, beyond just setting up the actual clinic and where the shots are going to be administered. Almost more important is the flow within your building, how people are approaching the clinic, how they are directed by staff. You have to be very, very detailed on that to pull it off, especially if you get short notice. We created a pre-registration table by surveying residents even before we had a date, a firm date or a confirmed date. We surveyed the entire population, both staff and residents, to find the yeses. And so that was just a quick survey form. And then that really informs you as to what sort of information or education you're going to need within your building. In our case, we had an overwhelming response of people wanting to sign up, and so we immediately set up all-day registration tables in our dining room area. And so that people could come down. It takes time to fill out the forms. The form that is available online is not the same as the triplicate form that you actually receive from the pharmacy. And so, those are things that need to be worked out individually. And the more you do that in advance, the smoother the clinic will go. There were 4 stations, and so we had separate line areas. So there was pre-registration line, then there was a gathering area to organize by number before you approached the clinic area, and then there was a short line before you went into the clinic, and then a line out of the clinic to a resting area where they could be observed, and we had some snacks and water bottles while they could socially distance, and we could just observe that there was no immediate reaction. All of those staffed by a staff member. Our clinic ended going pretty much through the day from 10 to 4 without a break. So be prepared for quick snack breaks. In addition, with the Pfizer vaccine, they often have to pause to thaw additional doses. Our particular pharmacy was extremely careful about dose amounts. So be ready for that as well. At times, they might just stop your clinic for a half hour while they're literally thawing out and mixing additional doses and drawing out the syringes. So it was very successful. It took a lot of work. Our CVS Omnicare sales representative was extremely helpful. So that was a great resource. They want our prescription business, and so they were very helpful. And then the clinic team that we received was also extremely professional and well organized, although they did start administering vaccines 1/2 hour late. So also be prepared for a potential immediate delay since it took them a little time to get their act together. So that's pretty much how our clinic went. It takes a real team effort, and then the leadership must be visible and roving the entire time to put out fires, answer questions, just respond to complaints, and just basically be visible. So that was pretty much how our clinic went.
So just to confirm this question that just came in, so are they asking for new consent vaccine forms to be completed, triplicates, if we have already been completing the single forms?
No, you do not. We also did not receive our triplicate forms until after we had pulled the online form. What you do need to do is make 3 copies of the online form that you print. They'll need one. The resident needs one, and then if you keep medical records at your facility, you'll need a copy. And so you have to make your own triplicate. We did end up making only 1 copy of ID and insurance card. We were making 3 copies at the suggestion of our sales rep, but really only the pharmacy needed that. The resident doesn't need a copy, and we, as an independent living facility, do not keep medical records, so we did not need that 3rd ID copy either. We did switch to using the triplicate forms once we had it for consistency.
Thank Thank you so much. We actually had another question that I received privately. Did they receive the triplicate forms in advance? We have not received them and are hearing that is a form that must be done.
We did not receive ours until the day before the clinic started, because they were mailed, and so we used the form that's available through the CVS Omnicare, and I'm sure Walgreens has the same set of documents. There's a toolkit you can go on the email you receive from your pharmacy where you can pull up the updated COVID vaccine intake consent form. It is different than the triplicate form. However, the pharmacy will take both. One of the things we found is that the pharmacy's sole interest in tracking this was to get the insurance information, the Social Security card if they had it, and the photo IDs. They were didn't seem to be tracking the other information in order to get the shot in the arm, which was our focus. We did answer the questions on the forms, but all they were really looking for in order to put in their system at the time was really just the information on the basic information is what they needed. So we did not spend a lot of time making sure that every single form or question was answered. What we needed was their insurance information, accurate address, clear spelling of their name, Social Security, a triplicate in whichever form you used, whether it's the one you print out or the triplicate they give, and then a copy of the ID and insurance card, all kept together.
Thank you. One more question. Are they willing to go to any individual apartments? For instance, in one case, we have a tenant on hospice and they indicated the tenant should not come down to receive.
That's an excellent question. We actually ended up having 9 residents, for various reasons, request in-unit vaccinations. Most facilities, from what the pharmacist told me, are doing their clinics in unit. And so they are going room to room. And however, we found that centralizing the clinic and bringing residents who were mobile or able to the central unit was more efficient. That's what they told us. But we do have residents here as well who are not able to leave their unit. And that was part of the registration process. And so sometimes their aide would come down. Usually they're known within the building, and so we actually would reach out to them. We communicated on the clinic basically on a daily basis. We door knocked the residents who we knew were bedbound. And then the real thing is to control the forms, bring them to the residents, keep them in your possession and organized, and then pass them out to them literally right before they go in to get their shot. And so that's the way we sort of avoided confusion, lost forms, missing IDs, or things like that.
Thank you, Paul. I'm so glad that you all had such a positive experience. And thank you so much for being on and sharing that with us. I understand
You're
that
welcome.
Thank you. I understand that Juliana is able to get on now to talk a little bit about the PPE exchange.
Yep, can you all hear me?
Yes, over to you.
Wonderful. Thank you so much. Good morning, LeadingAge. My name is Juliana Gordon, and I am with PPE.exchange. We are currently partnered with the Virginia Hospital Association and other partnering organizations within the state of Virginia. I just wanted to be here today to really just give a quick overview of what we do and also ways that we can actually help you all access PPE. And this PPE is from our over 300 verified vendors that we currently have on our PPE.exchange platform. And what we do is we provide a platform for vendors to have storefronts to the PPE that they have. These verified vendors go through a 4-step verification process with our vendor verification team. We are also integrated with the Open FDA database. So what this means is we have complete verified PPE and high quality of PPE. Due to the nature of our platform and what this really is this is an Amazon-like platform where you can go through and browse different PPE products and go through and purchase those PPE products directly from the vendor. We have a smart escrow system on our platform, which means that you are able to have your money and hold it until you do receive your shipment. Why I wanted to talk about this today is we recently had a collaborative purchase with the state of Virginia through Virginia Hospital Association. And I'm sure a few of you definitely attended our webinar because I know a few of you participated in the collaborative purchase. But what this is we have 3 ways that you can access PPE. The first is the Amazon-like platform that I just mentioned, which is at ppe.exchange, and I can definitely throw that in the chat. The second is through the collaborative purchase, which is hosted by the Virginia Hospital Association. And this is a link that is sent out across the state of Virginia where we pull the demand across the state and start providing PPE based on that. This is similar to a group order function, but we automate the whole process to make it a lot easier on folks to check out directly through their computer or cell phone using credit card, ACH, or of course an invoice system. This recent collaborative purchase that we did have with the state of Virginia, we had 3 products that we were offering: isolation gowns, level 2, N95s, and 3-ply masks. We did meet the MOQ, and those shipments will be received in the next 2 weeks, which is absolutely fabulous. So we're really excited about the success there. I do want to let you all know that you will continue to see these collaborative purchases get pushed out throughout the state, whether it's involving different products, different items. And if there are products that you do want to see or you do need right now, please feel free to reach out to me directly, and I can definitely help you out there. But ultimately, we are completely free to use, and we're here to support. So please, again, feel free to reach out with any questions or yeah, if there's any questions, excuse me. But yeah, I'll just switch it back to you, Dana.
Thanks so much, Juliana. We appreciate the update and look forward to our continued work together on the PPE exchange. I know we have a lot of inauguration events going on, and we want to get to that. So I wanted to say that our next call is going to be on January 27th, tentatively, and we are looking toward that call to potentially have a panel discussion and member discussion about testing strategies, visitation policies, and changes in dining and activities in terms of physical distancing and so forth now that we're moving forward with the vaccine. So that is a discussion that we will be having for a future call. So if you're interested in speaking on that, please let me know. But I want to thank everybody for joining us today. Melissa, are there any questions that we need to finalize in the chat box?
There are not, Dana.
Okay. All right. Well, thank you all to our speakers today, and thank you so much. For anyone that has any questions, we're here for you. Please don't hesitate to reach out. Have a great rest of your week.